Welcome to the Division of General Internal Medicine at Mayo Clinic in Rochester, Minnesota. Whether you are coming to Mayo Clinic for diagnosis, treatment, or both, you will be cared for by an exceptional team of providers. Our physicians, nurses, medical technicians, and allied staff will work with you to determine the cause of your symptoms and develop a treatment plan to meet your needs. If you are a new patient to Mayo, your first visit will typically include 3 parts: an initial appointment with a Mayo provider. Then, depending on your medical issues, you may be scheduled for tests, imaging procedures, and appointments with other Mayo specialists. And finally, you'll have a summary visit with your provider. The length of your stay will depend on the number of tests and consultations you need. A typical visit can range from 4 to 7 working days.
Are you new here at the Mayo Clinic?
I am.
Okay.
When you arrive, a staff member will spend a few minutes verifying your information and the reason for your visit. He or she will check your blood pressure, height, and weight, and will also review any medications you are taking. So remember to bring a medication list or the medications themselves. At the first meeting with your provider, he or she will spend time talking with you about your medical history and the concerns and issues that brought you to Mayo Clinic. Your provider will also conduct a physical exam and review your medical information. It's during this meeting that your provider will order tests or imaging studies as necessary. He or she may also refer you to Mayo physicians in other specialties for further consultation.
Past any, you could have some in the kidneys, so we'll do some x-rays to make sure that that's not going on. And then finally, have you see one of our endocrinologists to review the results of these things, and we'll have you visit one of the folks that specializes just in calcium problems.
Is that all here, or do I go somewhere else for those tests?
All tests, procedures, and consultations with specialists will take place on-site at Mayo Clinic and will be scheduled as efficiently as possible. Before you leave your first appointment, the desk staff will give you a printed schedule for any tests and additional consultations. They can also provide you with maps and directions you may need for getting around Mayo Clinic and the city of Rochester.
Subway connects you to every building
Oh,
here.
okay, great.
Yep.
Wonderful.
Mayo Clinic's Department of Laboratory Medicine performs more than 22 million laboratory tests every year. That number includes tests done with patients on site and tests on patients from around the world that are sent to Mayo to be analyzed. More than 3/4 of Mayo patients have an imaging study done to aid in their diagnosis or treatment. That's nearly 4,000 X-rays, MRIs, CT scans, and other imaging studies conducted every day. Depending on your medical issues, you may be scheduled for appointments with other Mayo specialists. Our team approach gives patients the opportunity to consult with specialists in nearly every medical field. As always, feel free to ask any questions or express any concerns you may have.
Is this something that in the future I'll need to watch my diet, or what kind of things will I need to do differently so that I can take care of this in the future?
That's a great question. And actually, even though your blood calcium is elevated now, we wouldn't...
After testing, imaging, and specialty appointments, you will meet again with your initial provider to review results and discuss the best treatment plan for you. This may be your final visit, or additional appointments may be scheduled depending on your medical needs.
And if there are questions, that the family brings up, certainly don't hesitate to get in touch with us. So, and I'll also be writing Dr. Wittich, your doctor at home, with a summary of everything, so he'll have all the information as well, and he may be a resource for you too if you have questions.
Wonderful.
And we'll get this set up promptly. Okay. Anything else I can help you with, or any other questions today?
Not at this moment. I probably will have questions 10 minutes from now.
Well, you know how to get in touch with us, and don't hesitate to do that.
All right.
Good.
Well, great.
Nice
Thank
to see you again. Thank you.
Thanks
Glad
so
we could
much.
help.
Thank you.
Bye-bye now.
Mayo Clinic is a nonprofit worldwide leader in medical care, research, and education. For more than 100 years, our goal has been to provide the best care to every patient every day. Thank you for choosing Mayo Clinic.